Hello, viewers and listeners for Heart Trending. This is Chadi Alraies with you to talk about peripheral arterial disease. We hear the term peripheral arterial disease a lot, and this is a term used for patients who have blockage or stenosis in the artery supplying blood to the lower extremities. Oftentimes, the symptoms of these patients present with pain when they walk, or sometimes resting pain, described as pressure on tension or fatigue when they walk. Oftentimes, these patients have to stop after a few steps, maybe half a street block or more, a little more. And when they stop, these symptoms are completely subsided. In severe cases, patient will continue to have this pain, especially in the calves area, that is at rest as well. What are the risk factors for peripheral arterial disease? The risk factors are smoking, number one, which is constitute to more than 50% of the patients with PAD have history of smoking. Number two is hypertension, diabetes, high cholesterol, and also family history. Moreover, patients who have disease in the heart, or what's called coronary artery disease or stents in the heart, are also prone to have or at risk for developing peripheral arterial disease if not already have peripheral arterial disease. So how do we screen for these diseases? So when you are checking with your primary care, I think it's recommended to report any leg pain, cramping, or weakness, or even tension and pressure in your legs. These symptoms are very important to report, and usually we have posters in the clinic to explain these symptoms, especially with walking, but also even if you're having it at rest or when you're watching TV or at bedtime, is to report these symptoms to your primary care. The screening tools are very easy. Is considered what's called ultrasound of lower extremities or ankle brachial index. This is when the technician, when they listen to these tests, have a blood pressure cuff that sits on your arm. Similar one we measure for blood pressure. And also another one on your leg in 7 different spots in your leg. And that will give you the evaluation of the right leg as well as the left leg. If there is any differences in the blood supply to each leg, that will be reported on the exam. If there is any blockage or any risk for it, especially if somebody is a smoker, have diabetes or other risk factors that I mentioned earlier, then the patient has to be referred to a specialist to take care of these blockages. Oftentimes we send them to a vascular surgeon, which is their specialty, or sometimes people go to cardiologist or interventional radiologist. But bottom line, your primary care will refer you to a specialist to take care of this problem. So what we go from here? How would you treat it? Usually this is confirm the diagnosis with what's called angiogram of the lower extremity. This is when the patients lay on the table and have access through one of the groin arteries and go in the needle and advance the catheter and eventually shoot contrast dye in the vessel to see if there's any blockage. If the blockage is significant, the procedure is, or the operator will be advancing a wire and then balloon and maybe stenting that area. The relief of these symptoms is immediate, but more important than the symptoms is also if your patients start to have some tissue loss, meaning an ulcer in the foot, in the toes, or in the heel. These ulcers are very hard to heal despite maximal antibiotics and treatments and blood thinners because the blockage and the blood supply to this area is compromised. Therefore, opening this artery is critical, or bypassing it by putting a bypass conduit by vascular surgeon colleagues are very important. Finally, what is the medication that we usually prescribe for these patients? Usually aspirin, baby aspirin, the 81 milligrams over the counter, called aspirin, Bayer aspirin is important medication, as well as controlling the diabetes, tight control of the diabetes by making sure your cumulative glucose, or what's called the hemoglobin A1C, is less than 6 or closer to 6 to make sure this diabetes is under control and doesn't expedite the problem of building plaque in your arteries, in the heart as well as in the legs. Finally, there's other medication for controlling blood pressure that's recommended, as well as other blood thinners such as a drug called clopidogrel or Plavix or ticagrelor or Brilinta, or other blood thinner that's considered rivaroxaban or Xarelto or Eliquis. or apixaban. These medications are oftentimes recommended by your specialist, but this is a case-by-case recommendation. But bottom line, patients should be going home on aspirin, tight control of blood pressure, as well as diabetes. And more importantly, exercising regularly, as well as lifestyle change in the diet. Cut back on the fat, red meat, focusing on the white meat, chicken, fish, broiled, grilled food, vegetables, and not deep fried food. I hope you find this video useful and informative. Please drop a comment if you have any question about if you or your loved one have any history of peripheral artery disease or leg disease. And see you in the next episode. This is Chadi Alraies from Heart Trending. Thank you for watching.